Good morning. Today in psychiatry concept lesson, I'm going to teach one interesting and very easy concept. It is nothing but seasonal affective disorder. What is the seasonal affective disorder? S-A-D, sad. So naturally, what is it? Sad and the depression. Seasonal affective disorder or depression. It is also called as winter depression. Okay, it's a very interesting concept. It's actually less common in our countries, but notoriously they have been asking in all types of this aims, INICET and NEET patterns. Somewhere they feel that okay, students will not concentrate on this, let me ask questions in this area. But we should play with their minds. We should know about what are the questions that is asked in this topic. Seasonal affective disorder or winter depression. See what happens normally when light is very important for human life. You know that, right? The light enters your optic nerve, optic tract, optic asthma, then goes to the it goes to the occipital cortex. So and it has its own pathway. There is one specific pathway called as retinohypophyseal tract. Okay, it goes and secretes some important hormones called as melatonin and stuffs. Now what happened? I just want you to understand that when there is decreased light, naturally the hormones that is need to be secreted inside, especially melatonin, tryptophan related serotonin, there will be dysregulation in it. So people will fall into depression. Who are all more prone? Winter season, cold countries, Canada and all, you can see that there will be snow most of the time. There will be no sunlight at all and lack of sunlight. When there is no light, there will be dysregulation of what? Melatonin, tryptophan, other mediators, and also serotonin, which makes the person goes into biological changes and fall for depression. Now I am going to ask you a question. The person is in Canada or is in India where it is more winter and there is no light. Now the person is depressed. No light and so he is depressed. So what are you going to treat the patient with? Sir, I will treat the patient with light. Yes, light therapy. Light therapy. Now a question is there. Okay, person is having so and so in Canada is having exposed to a lot of winter season and he's having depression. What will treat with? A, antidepressant, B, antipsychotic, C, anti-anxiety, D, antidepressant plus light therapy. You should not get tempted to answer the first choice itself, antidepressant. No, read all the choices. Whenever you read something related to winter depression or seasonal affective disorder, your mind should automatically search for, is there any word that goes towards light therapy plus antidepressants. Now one specific JIPMER question I will tell you. There they have asked what is the flux of light. Light means whatever light can be used or what is the flux of light. The answer is between 2500 to 10,000 flux. Only once they have asked, but I thought I should not miss that also, so I have given that also. 2500 to 10,000 flux. Okay, very simple. Is it difficult? No. I'll tell again. Seasonal affective disorder, SAD, or winter depression. What is this? See, in countries where there is too much winter, or in western countries where there is snowfall, where there is lack of sunlight, the retinohypophyseal tract related melatonin, tryptophan, serotonin mechanism is all altered. So naturally dysregulation occurs. So they'll be more prone for depression. Now no light, so depression. Treat them with light. What is the therapy? Light therapy. Now in one JIPMER exam I told you what they asked. What is the flux of light they use? It was a tricky question. They all know, most of the students, they knew that light therapy is used, but there will be choices like what to say, 50,000 flux, 200 flux, 300 flux, 2700 flux. So what happens is 2500 to 10,000 means it will be answer is right. So 2500 to 10,000 flux. This is 10,000, 2500 to 10,000 flux. Okay, thank you.